Royal Melbourne Receiving.
Coming here with a 19-year-old female, history of asthma.
Dr Bjorn Macon has been an emergency doctor at the Royal Melbourne for 5 years.
Royal Melbourne Receive, we'll see you in 5 minutes.
He's got just minutes to prepare for a young woman arriving by ambulance who's having a severe asthma attack.
We need to get the non-invasive set up and I need nursing staff.
Yep, all right. They're going into R6.
Okay, cool. I'll go and set up there. We should set up for what the worst case scenario is and then hope for the best. So we'll just meet it with an appropriate crew to be able to deal with sort of someone who's crashing. The bed's not made and we haven't got an NIV in there, so I'll need
so maybe we'll have to do it in here.
Yeah, just nebulized salbutamol, Atrovent.
With so many patients in emergency, resources are overstretched. As the paramedics arrive, Dr Bjorn is making the bed.
This patient is critically unwell and we need to get her onto bed, and if I can facilitate that, that's great. And if I have to do the bedpan or wipe the bum or do whatever's necessary, then that is absolutely my job, and I truly believe that.
Okay, it's going to be a sharp movement. 1, 2, 3.
Gabrielle is a 19-year-old shop assistant who's only recently developed severe asthma.
Focus on the breathing, okay? Don't stress. We'll get things sorted out.
She's been hospitalised more than a dozen times in the last 2 years.
So, Gabrielle, do you feel like your breathing's gotten better since we started with the mist, or do you think it's gotten worse? Gotten worse, has it?
The ambulance paramedics had given her steroids very early on in order to try and reduce the swelling. That's the mist. The basic treatment of asthma was a nebulized medication to try and target the lungs specific.
Were you at work when all this started? So you still managed to get to work, huh?
Gabrielle took a break from work to buy batteries for her portable nebulizer when she collapsed in the chemist.
When you've been in the ICU, have you ended up having to have a tube put down to breathe for you? Once before. It's pretty bad, isn't it?
If Gabrielle's attack isn't brought under control soon, the next step is to intubate by putting a breathing tube down her throat to pump oxygen into her lungs.
Just gonna have a listen, okay?
The reason that intubation is not a good idea is because it doesn't fix the problem.
Deep breath for me.
In an asthmatic, it is really the intervention of last resort.
Okay. And there's a bit of a wheeze, but there's quite a lot of coarse crackles there too. Have you been having any fevers over the last few days or weeks?
Virus.
Virus. You've had a bit of a virus, have you? Have you been taking any antibiotics or anything like that? No, okay. We're going to go into flu precautions. Can we just get face masks on, everyone? She's really had quite a lot of therapy so far, and it doesn't look like it's really making much difference. I'm a bit worried about you because you're just working so hard that you're going to get tired, okay? And you know that when you get tired, that's when you end up sort of with that tube breathing for you, and that's not necessarily the greatest thing in the world.
In essence, what she's doing is she's breathing through a straw, and even a healthy young woman will eventually become exhausted. She will no longer be able to generate the forces necessary to breathe through that straw, and she will very rapidly decompensate and potentially die.
You're still going to hang in there? Don't panic. Just try and breathe with the machine. You're doing a great job. You just focus on that breathing, okay?
In the resuscitation unit, 19-year-old Gabrielle is battling a life-threatening asthma attack.
I'm worried about you because you're just working so hard.
And she's not responding to drug treatment. Dr Bjorn Macon fears she's in danger of complete respiratory failure.
I'm very concerned because, especially finding out that she's previously been intubated and been in ICU on multiple of those occasions, would mean that she has a very severe form of asthma.
We're just going to do an X-ray, okay?
In my mind, I'm thinking of all the things I should be doing before I take the most extreme intervention and intubate her, but also kind of preparing for that possible intervention that needs to occur.
Okay, big breath in, breathe normally.
Dr Bjorn x-rays Gabrielle's lungs. The x-ray result is surprising, and Dr Bjorn decides to change treatment.
Well, that's unexpectedly good. But her lungs are pretty clear for all that crackles.
This mask we're going to pop on you. Now, the theory is it pushes the air in and helps you breathe a bit more and gives your lungs a rest, okay, because you're looking very tired. It fits very tightly, though. Can you feel it pushing the air in?
Does it feel like you're not getting enough breath, is it? Sort of, okay. Is it just that you have to fight to get a breath in, is that right? Yeah.
Gabrielle's still struggling to breathe with the oxygen mask.
What we're trying to do there is we're trying to reduce the work of breathing because she's going to very rapidly get exhausted.
She's just tight. I mean, the adrenaline, I think, is the next step. So we should start the adrenaline infusion.
The intravenous adrenaline should keep Gabrielle's airway open and relax the muscles to her lungs.
Do you feel better? Sort of, okay.
If the adrenaline doesn't work, Dr. Bjorn may be forced to take over Gabrielle's breathing.
It's a very fine balance of intervening at the right time, but not too early and not too late. What I'm thinking is about when is the right time to intervene.
Her worried parents, John and Rita, have just arrived to be with their youngest daughter.
And what we do now is leave things for half an hour. Okay, we'll watch her very closely, and then we'll have a chat after that, okay?
Gabrielle messaged her mum from the ambulance after collapsing in a chemist near her work. Visiting emergency has become a familiar and frightening routine for the family.
Nothing you can do. Nothing. It's just frustrating. Oh, she's a good kid. Oh, she's not a kid anymore, but yeah, sorry. No, she's good. We got the good one, except for this, yeah. Yeah, we're just, hoping that miraculously that it might go as quick as it came.
It's the shop assistant's 14th visit to emergency since her first asthma attack 2 years ago.
I have 3 children. I think being a parent gives you an insight into what people are feeling when that loved one of theirs is critically unwell.
Dr. Bjorn suspects there could be another trigger for Gabrielle's frequent asthma attacks.
Sometimes anxiety is part of the issue. Like if you're anxious, you're going to breathe faster, and if you breathe faster, you don't ventilate as well, and so it can be this sort of spiral. There we go, perfect timing. How are we doing?
I cannot see anybody being anything but anxious when they are struggling to breathe to that extent.
Let's have a listen at your back, my dear. Deep breaths.
Dr. Bjorn decides to keep Gabrielle in hospital overnight to monitor her breathing.
The classic anxiety versus asthma.
At the main desk, he's catching up with his wife, Dr. Maya Cubitt.
I keep having to validate my belief that it's actually asthma, and yes, there might be a bit of anxiety, but she's pretty sick.
Anxious for a reason.
Yes, exactly,
Maya and I met in our first year of medical school, and Maya is often the person who is my sounding board, my go-to person.
We're going to go into flu precautions. Can we just get face masks on, everyone?
Dr. Bjorn's asthma patient, Gabrielle, was kept overnight for observation after her 14th visit to emergency in 2 years. She was discharged the next day.